Hi, good evening, everybody. This month is February, and welcome to the Health Talk again. So, what do we have for February this month? So, today's Health Talk is about breast cancer surgery. My name is Andrew. It's my turn again this month. So, I'm the Psychosocial Service Manager. I'm also the counselor at 365 Cancer Prevention Society. Hi, good evening to those who have just joined us today for the Health Talk again. So please like and share today's health talk so that more people can benefit as well from the Facebook health talk today. So as I mentioned, right, today's health talk is about breast cancer surgery. So we'll talk about what's the role of the surgery, when it should be done, and the different options for breast cancer surgery. So before I walk you through the talk, let me just share a little bit about the itinerary for today. So we are very honored today to have Dr. Chan Ching Wan. She's a senior consultant, division from Surgical Oncology, National Cancer Institute, Singapore. So she'll share with us a little bit more about what is breast cancer surgery. So we are also very honored to have Jill today. She's a breast cancer fighter. So she also share with us her breast cancer journey experience with us later on. So moving on, please allow me to share with you 365 Cancer Prevention Society, what we are about, our services and our program. So 365 Cancer Prevention Society is a non-profit social service agency in Singapore where cancer fighters, caregivers find support in their fight against cancer. They also learn how to cope and manage with cancer as well. So the threefold mission of our society are cancer prevention, where we seek to prevent cancer in various means. Cancer fighting, for those who are affiliated with cancer, we walk along them and provide support in their battle against cancer. Last but not the least, cancer education, which is what we are doing today, is to promote holiness, wellness through education. It is also to create cancer awareness to the public as well. So let me go through what are the services we have at 365 Cancer Prevention Society. So up first, we have, as you can see in the slides, I'll talk about the social service centers in a bit. We have counseling services where you can find emotional support, learn about adaptive coping strategies. And we have nutrition consult as well by a dietitian in-house. And each member is tagged to a care leader where they show care and support through visitations, whether you are at home or hospital. They also do phone care and concern as well to you. So each member is tagged to a care leader. So they also provide financial assistance and support for those who are in need. Moving on, we have 3 social service centers here in Singapore. So where are the locations of the 3 social service centers? Namely ABC. I think we have mentioned it a couple of times. So A is in Ang Mo Kio, B is in Bukit Panjang, C being the latest center that we have is in Clementi. So you may ask me, Andrew, so what does the social service centers what do they do? What do they how do I go there and stuff like that? So mainly the social service centers, they organize programs and activities. Like recently, they just reconducted quite a fair bit of class. Of course, there's a limitation on participants. So such as art classes, etc., where the members can just go in, make friends and learn some skills at the same time, find support through one another. And of course, not forgetting the health talks that we are conducting every monthly. So every month we conduct at least twice health talks through Facebook live talk like today. So one in Mandarin and one in English. And also I think if you have any good suggestion, there are various topics that you would like us to talk about, please feel free to comment and put in the Facebook comment below so that some of the ideas we can run through and then we can conduct the live the health talk as well. So the other platform that is meant for our beneficiaries is our every Wednesday. It's on a weekly basis, Zoom health talk. So the talk mainly cater more towards cancer survivors and cancer patients, how to deal and manage treatment side effects or generic diagnosis, or how to adjust to a new different lifestyle. So these two are the basically health talks that we conducted. Moving on next. In conjunction to February, it's a World Cancer Day. So we actually prepared 3 quiz for you guys today. So there are prizes, mystery prize. So the prize is combined from 365 Cancer Prevention Society as well as National Cancer Institute of Singapore. So the winners later I'll announce how you can collect your prizes and stuff like that. So please stay tuned and stick with us to the end of the health talk. So there will be 3 quiz that will be asked at the end of the health talk. Of course, just now I mentioned one of the questions will be, in the earlier segment that I have shared with you. So the other 2 questions will be pertaining to the health talk later on. Okay, and also we will have a question and answer segment. So if you have any questions pertaining breast cancer surgery, or you have feedbacks or encouragement, please feel free also to add into the Facebook comment below. Okay, so without further ado, let us welcome Jill on board. She'll share with us her cancer journey and experience. Hi Jill, I shall pass the time over to you.
Thank you, Andrew. Hello, everybody. My name is Jill. I'm 54 years old. I was diagnosed with stage 1 triple negative breast cancer in June 2020. At the time, I was at home taking an online course when I suddenly felt a pain in my right breast. And then I touched and I felt a lump. My instinct told me something is not right. However, I thought I may have hit my breast by accident and decided to wait a day or 2, hoping the pain goes away. But unfortunately, it did not. So I went to see my family doctor, who did a scan for me and saw a black patch about 2 centimeters. He wrote me a referral to see a breast doctor in SGH. I didn't go through the usual denial stage, but went straight to acceptance because I know that I just had to deal with it and get this treated ASAP. The most difficult times was dealing with the chemo side effects. But I told myself that I have to go through this, and I also can be a cancer warrior. What motivates me is that I want to see my 2 children go through university, and I'm very thankful to my family supporting me through chemo. My mother took care of me, my brother fetching me to and from my chemo sessions. It was by a timely coincidence that my ex-colleague had just completed her chemo for breast cancer, and she introduced me to 365 Cancer Prevention Society. I'm so very thankful for the holistic and sincere support from 365 Cancer Prevention Society, especially my carer, Beth, and Stephanie, the dietitian, for teaching me how to eat well to build back my body and immunity, without which I would have been so lost. And a great big thanks to all 365 Cancer Prevention Society donors and volunteers for building and maintaining this awesome organization. And for all cancer fighters out there, keep reminding yourself what motivates you to fight this battle, and you will win. Can you? Thank you. Back to the host, Andrew.
Hi, Jill. Thanks for the inspiring sharing and, of course, your cancer journey with us. Indeed, I will agree with Jill that we need to keep reminding ourselves what motivates us in the fight against cancer, and we will definitely win. So let us thank Jill again for sharing with us the cancer journey and the motivating, inspiring talk. So she will also join us in the Facebook platform as below. If you have any encouraging words or personal questions, you can feel free to ask her in the Facebook comment below as well. So we can welcome her in the Facebook comment there. So without further ado, let us move on to the next segment. So maybe invite Dr. Chan. So she'll share about a lot more in depth about what is breast cancer surgery, the role and types of option. Hi, Dr. Chan. I shall pass the time over to you. Hi, Dr. Chan, you are on mute. It's okay. Probably do a mic test with us again.
Sorry, can hear me now.
Hi, Dr. Chan. Okay, we have you back. So I shall pass the time again back to you.
I'm so sorry about that. Good evening, everybody. Let me just get ready to share my slides and then we can get on with our talk. All right. I work over at NUH, of which NCIS is part of it, and I've been a breast surgeon there for the past 15 years. I think in order just to, before we go into all the details about the operations, just to remind what breast cancer is and where it starts. And so the breast is made out of milk ducts that connect the milk lobules to the nipple. So the lobules are where the milk is produced, and then the ducts are where the milk flows through when the baby is sucking. And if you have a breast duct, the cells that normally line it are not very thick. However, when a cancerous change happens, they then overgrow and then they thicken up. As you can see in the middle row, there is that little column where the cells are thick, but they still are confined within the membrane that they sit in. And this is when the cancer is what we call stage 0, ductal carcinoma in situ. At this point, it hasn't got the ability to invade. However, once it goes beyond that particular stage and then it breaks through the membrane, that is when it then becomes a proper breast cancer. And with breaking through the membrane, these cells are able to travel into other parts of the body, either via blood vessels or also via the lymphatic ducts. And from the lymphatic ducts, the cancer cells can travel to the lymph nodes. And for breast cancer, these nodes are usually found in the armpit area of the same side. Okay, and we will be talking about these as part of the operation plans as well. And so what is the point of having surgery? Before I actually go into much details here, I just want to emphasize that surgery is only part of the treatment for breast cancer. Once you have a cancer, it usually comprises, you need several different types of treatment in order to control it properly. And surgery is only one part of it, so not everything. But back to the aims of an operation, and that is to remove all the cancer that you have in the body. And if I cannot achieve this goal, so if I operate and I cannot remove all the cancer so that there is still cancer left in the body, this operation is considered not complete. And of course, there are certain situations where there's too much cancer everywhere and we are certainly never able to remove all of it by an operation. And in this kind of situation, we should not be operating. In any case, the second point about doing an operation is to also stage the disease. And staging tells us how advanced the cancer is in the body. And when we know how advanced it is, and so whether is it stage 1, is it stage 2, or is it stage 3, this helps doctors to decide how much treatment we need to add on as well, whether it is chemotherapy or whether it is radiotherapy or other types of treatments. So when we talk about surgery for breast cancer, there are 2 areas that we need to focus on, one of which is the breast and the other one is for the lymph nodes. And before we go any further, I just want to emphasize that breast conservation, or what most patients normally know of as lumpectomies, as long as you have radiation on top of it, is as good as having a mastectomy. And patients who have had breast conserving surgery live as long as other patients who have had a mastectomy, okay? And it's very important to remember this. And so if we go into the details now. So breast conservation is commonly known as a lumpectomy, but the official term is also wide local excision. And in this one, the advantages is you can keep your breast. You have the same long-term survival as if you've had a mastectomy, like I said before, but you will need radiation. And the other condition about a lumpectomy is if the lumpectomy did not remove all the cancer tissue, then another operation will be needed to remove the remaining cancer that is still in the breast. And this I cannot emphasize strongly enough, because like I said before, we really want to remove all the cancer and we cannot leave any behind. This is a diagram to represent what a lumpectomy is. And as you can see, there's a small cut, it removes the lump, and there is a rim of normal tissue around it. And it is this rim that when I see it under the microscope, so I know that the cancer cells are all contained within a boundary of normal breast tissue. That's how we doctors know that the cancer has been removed completely. All right. I've been told not to show live pictures because that may violate Facebook policies. And so on a diagram, these are the positions of the types of scars that patients may have when we do a lumpectomy. There is now actually a slightly more advanced form of conservation, and it's been called oncoplastic surgery. This one actually combines not just breast surgery techniques to remove the cancer, but we also incorporate plastic surgical techniques in order to remodel the breast so that it still looks normal apart from the scars, but it also enables us to get clear margins on our cancers and still achieve acceptable cosmetic outcomes. And these are the principles. Of course, paramount is to remove the cancer properly. And then we will actually do sometimes partial reconstruction to correct the cavity that we created after our operation. And sometimes as well, because occasionally I may change the shape and size of the treated breast. And then we can also do an operation to make the normal breast, so the other side, look and match the appearance of the treated breast so that there is no imbalance between the two. Okay, so just a few diagrams so that you can get a picture of what we do when we do oncoplastic surgery. We actually take out larger volumes of tissue, and we also take away excess skin, and then we reshape the breast. And there are various ways we can do it. This one shows that if the cancer was behind the nipple and that we needed to sacrifice it, we could actually also recreate a little skin flap that can take the place of the nipple as well. And this one is where there's a large quarter of the breast that's been removed, and then it actually shows how we use the breast tissue on either side of the deformity, and then we free it up, and then we pull it together, and then the skin is actually stitched together, so much so that you don't really see very much. Very important for us is how we hide the scars so that it is as inconspicuous as possible. All right. The next form of oncoplastic surgery is slightly more this one actually involves taking more tissue away. And when we do a reduction, what this means is that apart from taking away the cancer and the surrounding tissue, so much needs to be taken away that actually change the size of the breast. And so in order to maintain a normal shape, I have to make it smaller. And so the breast is reduced in size. And this is the situation where if patients would like it, we also perform a similar procedure on the normal side, so that we reduce the size of the normal breast so that it now matches the size of the treated breast. Okay. In terms of reconstruction after a partial or the breast conserving surgery, you can see that these are just patches of skin and fat that we may harvest to fill the hole that we've created in the breast. And they are all based on blood vessels that come out of the rib cage. And they actually supply the fat and the skin tissue that we take, so that when we move it into the hole that we've created, it fills it up and it's living tissue, and it also feels nice and soft after that. Okay. So now we talk about mastectomies. A mastectomy is an operation where we remove the whole breast. It can be very simple. That means we actually just take away the breast and nothing else is done, no reconstruction, and that is called a simple mastectomy. However, more and more, and it is not wrong to want to still look normal after your breast operation. We are starting to actually do a lot of reconstruction after a mastectomy. And when we do reconstruction, we tend to actually do a slightly different type of mastectomy where we save as much of the skin as possible. And in certain situations, which is usually quite common, we can also save the nipple as well. We do tend to do this with reconstruction, and the whole point about a mastectomy, though, is if the lymph nodes have not gone, if the cancer has not gone to the lymph nodes, then after a mastectomy, you do not need radiation. And this is the difference between a mastectomy and saving the breast, which is the lumpectomy. When you do a lumpectomy, radiation is also an essential part of the treatment. And so these are just diagrammatic representations of what I was talking about earlier. Right on the left is the simple mastectomy. That's where the scars are. Although in the end, when we sew it together, you just see one line. For a skin-sparing mastectomy, we do tend to just take away the skin and the nipple area. But for a nipple-sparing mastectomy, as you can see, is just one single scar. And actually, when you look at patients, they look as though they've had a lumpectomy, because you only see one scar and the rest of the skin is still there as normal. All right. And this is, again, as you can see on the right, that's what a mastectomy scar looks like. Again, I'm sorry I can't show any pictures of proper patients. And so when we do reconstruction, there are many forms that reconstruction can take. You can actually reconstruct with an implant. The commonest type of reconstruction that most of my patients like actually is to use this particular flap, which is called a tram flap. And in this one, it actually takes tummy tissue and a sliver of muscle which protects the blood vessels that supply this flap of tissue. And then all of this is harvested by the plastic surgeon, and then they bring it up to fill the space in the breast. There is a muscle-sparing version of this particular operation, and this one is called a DIAC flap, where it is exactly the same. However, we don't take the muscle away, and this actually means that the tummy in that area is more normal than it was if you had done a tram, and not quite so weak. This is another area where we also can harvest tissue from, the back muscle. This is usually the swimmer's muscle, and it's a big muscle and can fill most breasts quite well, but usually not enough. And so sometimes we always have to put an implant in as well, just to boost up the volume so that it matches the normal breast. And then this one is, you can take flaps from the inner part of your thigh and also the back of the buttock. These two are actually more rare, but if you had well, if patients had them to spare, and the plastic surgeons may also sometimes suggest these as options. Okay. And so I'm nearing the end of my talk, but I just want to emphasize this particular thing called margins. And these are just pictures of specimens of breast cancers that have been removed during operations. As you can see, the bright center is actually the cancer. And you can see that there is a less bright, darker rim of tissue all around. And this is what we call the margin. And what we like is if the cancer is very much in the center and there's a large or there is a definite rim of normal tissue all around it. In the end, we really don't need much tissue we don't need much normal tissue around it to know that we've got it out completely. So that's why we do try not to take as much as we can in order that we can still maintain the shape of the breast. And so now we move on to surgery for the lymph nodes. And there are two operations now that can be done. One of which is the axillary clearance, and the other one is the sentinel node biopsy. Before we actually go into details, just so that all of you know what we are talking about, lymph nodes are little glands, part of the immune system. And in the normal scheme of things, say if you had a cut on the arm or infection in the skin, all of the bacteria and the toxins from those places would drain to the lymph nodes, where all the immune cells are waiting to deal with all these, either your bacteria or the toxins that come through. Cancer also travels in the lymph nodes, and then they go to the lymph nodes, and there they can also take root, and that causes the lymph nodes to swell up. And for breast cancer, they are usually the first site that cancers will spread to once it starts spreading. There are various groups that we need to deal with, and during the operation, we actually aim to remove all of these. And so that is an axillary clearance, where all those little nodes that you saw, those different groups, are entirely removed. Then we call it an axillary clearance. It's important in the past, especially, but also still important now, because we actually count the number of lymph nodes that contain cancer, and that tells us the stage. If you only have 3 lymph nodes with cancer, you're stage 2. Once it goes 4 to 9, it becomes a stage 3. And that's how we then decide how much chemotherapy, radiation, or other treatments that may be needed to add on. However, on the other hand, not everyone needs to have an axillary clearance. And what we have noticed is that in the past, when we did axillary clearance, there actually were quite a significant number of patients who had no cancer there. But once you have removed the lymph nodes, patients do get some side effects from this operation. Some will have a certain amount of chronic pain. There will be some numbness in the skin because the nerves that go through the armpit area would all have been damaged by this operation. And so that will cause permanent numbness in certain parts of the skin. Because of this operation, there will be scarring around the shoulder joint, and this can restrict the movement of the shoulder. By and large, fortunately, this can be easily overcome with physiotherapy. But some of my patients actually tell me they need to do this stretching and exercise every day in order just to keep the arm and the shoulder supple so that they can use it as normal. And so it does feel stiffer than usual. And last but not least, the most significant thing is that there is about a 20% chance of getting fluid retention in the arm called lymphedema. By and large, fortunately as well, most patients, the lymphedema isn't very significant. There is maybe a little bit of swelling in different parts of the arm. However, in very, very bad cases, the entire arm can be swollen, and then it becomes very heavy and also very difficult to use. And so because we realized that not all patients require a lymph node to remove all the lymph nodes, then experiments were done in order to try to decide who we needed to do the operations for. And then so the sentinel node biopsy started to come into practice. The sentinel node is the first node that will receive cancer when the cancer spreads to the lymph nodes. And what we know is that when we find this lymph node and then we test it, it tells us what is the chance of there being more cancer in the rest of the lymph nodes in the armpit area. And so this is how a lymph node biopsy is done. We actually inject a special medication. Sometimes we use a radioactive dye, and another time we also use a particular blue dye. But both of these actually travel in the lymph channels, and then they go to the sentinel nodes, and we can find these nodes. And these nodes are taken out at the time of operation, and we send them to the laboratory immediately, and my pathologists will look at it, and they will tell me whether they see cancer or not. And so if they see cancer at that time during the operation, I will immediately actually then take more lymph nodes away and do the axillary clearance. If we don't see any cancer, then we leave those lymph nodes alone. Because the check during the operation is quite quick, it's not a very thorough assessment. And so the lymph nodes are actually then tested again after the operation to be sure that there really isn't any cancer there. And by and large, certainly in NUH, but also most hospitals everywhere, if your sentinel node at the first check is normal, then the chances of them actually having cancer at the final check is about 5%. And in those situations now, because we understand the disease better, we may not always need to go back and repeat and perform the lymph node removal as a second operation. If the amount of cancer in the lymph nodes actually in the end are still very small, it is possible now to do radiation to the axillary area instead of going through the whole operation. But like I said, the lymph nodes and how many of them are affected tells us how aggressive the cancer is, and how advanced it is. And of course, the more advanced it is, we then would add on chemotherapy. You would need radiation therapy. And then finally, endocrine therapy if your cancer is sensitive to the hormones. And this is actually anti-hormonal therapy. We block the action of estrogen and progesterone on your cancer cells. Okay. So what are the side effects from operation? In the early situations, there could be a wound infection. The wound can break down and open up. There may be a blood clot there. And then if this is significant enough, this can also cause a wound infection. More commonly, there is something that we call a seroma. This is just fluid collecting behind the wound. And if it forms a large pocket and it causes a lot of symptoms, mostly pain because of overstretching, then we just need to put a small needle in and we can just suck out the fluid there. Sometimes as well, part of the skin becomes unhealthy because we thin the skin out very much. And so sometimes there's not enough blood that goes to that area, and then it can also die off as well. And in the late, that means further down the line, the part of the breast that had an operation, because it's quite fatty usually, the fat can become unhealthy, and then that will scar down and cause some hardening and scarring within the breast. And unfortunately, some patients have what we call scar hypertrophy or keloids, and that can also affect the appearance of the breast as well. And I think that's the end of my talk. And so I'm going to stop sharing and hand the floor back to Andrew. Thank you for your attention.
Hi, Dr. Chan. So thank you for the informative about breast cancer surgery. So breast cancer is actually one of the most common cancer among Singaporean women. All women are actually at risk of breast cancer. So I hope today we have a better understanding of what is breast cancer, how is breast cancer being staged by, and the types of surgery the breast cancer patients can undergo. So let us thank again Dr. Chan for the very informative health talk today. I will say that it's not, common to have a surgeon to give health talks every now and then. So if you have any questions, you have any burning questions that you have, please feel free to add in the Facebook comment below. We will answer you your questions shortly. So let's move on to the next segment. Like I mentioned earlier, we have, in conjunction to World Cancer Day, we wanted to create more awareness about cancer. So next we will have three quiz actually. So may we have the first quiz here. So the winners will be decided by the first one who answer accurately. So quiz 1. Breast conserving surgery, lumpectomy, is as safe as getting a total mastectomy, which is a surgery to remove the whole breast. Yes or no? So in short, does lumpectomy, it is as safe as a total mastectomy? Okay, for a moment I was afraid that there's no response, so the response just came in a bug. So yeah, so let's let's see. Okay, we have a winner for today. Is Linda Low. Okay, so let me just take down your yeah. Okay, we will share with you how can you collect the mystery prize later on after this quiz. Okay, so let's move on to second quiz of the day. Yeah, the answer is yes. So second quiz of the day. Surgery alone is sufficient treatment for breast cancer. Yes or no? Okay, we'll hold on a few more seconds for the correct answer. And maybe I can invite Dr. Chan. What do you think? No, what do you think? Actually, the quiz answer came from you, right? So what is the correct answer for the quiz?
Before the answers come in, well, okay, yes, but surgery alone is not it's not enough. So the answer is no. I hope we have a few correct answers.
There's actually quite a fair bit. Okay.
Yay, so thank you for listening.
Okay, so just give me 1 second. Quite a fair bit of answers. Yeah, we have a winner here. Esther Chan. Okay. Let's move on to the next quiz. This I have mentioned and shared with you guys earlier on. Name one of the services provided by 365 Cancer Prevention Society. Well, we have a total of quite a fair bit of services. You just need to name one out of the 7 services. Okay, thanks for answering the quiz as well. Thank you for participating in the quiz. So we do have a winner here. It's Ong SK. So these are the services that we have. In total, there are 7. So you just need to name one. Yep. So counseling is one. So congrats to Miss Ong SK. So counseling indeed is one of the answers, one of the services that is provided by 365 Cancer Prevention Society. And also like to thank Dr. Chan again. Just now, you give the answers for the above quiz. So congrats to the 3 winners.
Yes, congratulations.
So we have put together a mystery prize together with National Cancer Institute Singapore, as well as 365 Cancer Prevention Society. So hope that you will like the mystery prize. So let me just go through with you how you can collect the mystery prize. So it is very simple. If you go to our Facebook page, you will see a message. So what you need to do, or all you need to do, is just to leave your name and contact here. Yeah. Here you can send a message to us, your name and contact, and my colleague will get back to you in regards to where to collect, how to collect, and when to collect. And of course, if you think that, wow, Andrew, 365 Cancer Prevention Society has a lot of services that might cater to your needs, you can also reach out to us to sign up as our new member, and we will also get back to you, regarding this as well. And another part, just now Dr. Chan mentioned that. Let me wait for the slides to go off first. Yeah, you mentioned, there'll be stiffness after some surgery, and physiotherapy is good. So the other good thing is at 365 Cancer Prevention Society, we do quite a fair bit of physical exercise also. So there are feedbacks from our breast cancer fighters or warriors that it helps them to increase their range of motion as well. So if you're interested, there are various locations, and because of COVID, right? Previously we all do online and Zoom. So we are trying to restart everything face to face again, at a very slow pace, of course, according to all the rules and regulations. So feel free to reach out to us as well. So next we are moving on to also a very important segment where we will answer your questions and answers. Any burning questions, not literally burning so you have any burning questions, feel free to put in the comment. Okay, so first foremost question, okay, Dr. Chan, so there's this question that is kind of linked. When can I return to all my normal activities? How long will I need to be off from work after the surgery?
So to a certain extent, it depends on the type of operation that you choose. If you've only had a lumpectomy, then most of my patients actually are well enough to go back to work by 2 weeks. If you've only had a simple mastectomy, so you don't have reconstruction as well, most patients are also well enough by 2 weeks to go back to work. If you've had mastectomy with reconstruction though, then the recovery time is a little bit longer, especially if you've used your tummy tissue to remake the new breast, because then you also have wounds in the lower part of the tummy to get well from as well. And most ladies in those situations take about 4 weeks off. But by and large, definitely by a month, you would be able to go back to work.
Okay, Dr. Chan, thank you for the answers. So I hope we have answered some of there's a pretty common question asked by a lot of breast cancer patients. Okay, next question. This question is actually asked by, sorry if I pronounce your name wrongly, Fatima Wati Wahid. Can a breast cancer patient who has undergone mastectomy can also get COVID vaccine? This is one of the hottest topics now.
Yes, and very important question, and very good that you asked it. Yes, you can get your COVID vaccine. However, we do advise that you must be off active treatment. And what that means is if you're getting chemotherapy now or you're getting radiation therapy, you complete those first, and then after you've recovered from them, so give yourself about 1 month, maybe 2 months, then you can get vaccinated. For the rest of the patients who are, because some of you are on the endocrine therapy, so either tamoxifen or letrozole or anastrozole, so the tablets, you can get your COVID vaccine now. All right?
Okay, so I hope that is a very promptly question that is being asked now.
Yeah. Oh, and there's actually one other thing, because recently, actually just 2 days ago in the press, I think all of you must have seen it in the news that mammograms, when to do your mammograms in terms of your lymph nodes, sorry, not your lymph nodes, but in terms of the COVID vaccine, because some of our patients got the vaccine and then they felt lymph nodes in the armpit area and all of them panicked. And when we did the mammograms afterwards, of course, we could see the lymph nodes that were swollen. By and large, it is usually a response to the vaccine. But because you've had cancer before, none of us are going to be 100% sure. And so for that particular situation, firstly, if you know your date of your vaccination, if the mammogram is before your first dose, that's fine. Continue as normal, it will be fine. However, if your mammogram to rescan the breast falls between the first or the second dose, then you should push the mammogram to at least 6 weeks, but definitely 4 weeks after your second dose. All right. And then we will avoid that particular situation. I think most of us out there still haven't got your dates for your vaccine yet. So just go ahead with your mammogram checks if they have already been planned. It's only when you know your dates and then you think that your mammogram will fall between that period, then call your hospital and they will tell you how to alter your appointments and change the screening schedule. All right.
Thank you, Dr. Chen. I think that's a very important piece of info for all those who have going through mammogram and COVID vaccine. So please remember to take note on this. If you have any queries, also can always check back with your hospital and ask about the screening versus the vaccine as well. So yeah, thank you for Dr. Chen for this very important info. So let's move on to next question. Let's see. Okay, so Miss Yan, CH Yan, so she asked a question. So if there are two small modules on the same site, which is better? I think she's asking about surgery, lumpectomy or mastectomy.
Okay, so if there are two lumps, if you have two cancers in the same breast, it depends firstly how big the breast is, and it depends how close the two cancers are to each other. If the cancers are in different parts of the breast, and so one is on one half and then the other one is in the other half, so it's as though it's as far as China is from America, if you think of the breast as a globe. All right. Because they're so far apart, we actually have to take them out individually. We create a fairly big deformity in the breast. If you do have big breasts, then actually you may still be able to accommodate it. We make the breast smaller. That is when we would do a reduction. And then it's whether you want us to make the other side smaller as well. On the other hand, the two cancers could be extremely close together, so much so that they feel as though it is a single lump. In that kind of situation, we may be able to still do lumpectomy. It's just that it kind of depends how big a hole I leave in the breast. The bigger the hole, the more likely the breast will be deformed. And then if you still want conservation in that situation, then I have to think about how I can reconstruct that hole. And I may have to use one of the small flaps that I showed towards the end of the breast conservation slides, where we take tissue from around the breast and use it to fill the space that I've made. I hope that answers your question.
Yeah, so I hope that answers your question, Ms. Yan. Okay, so let's move on to the next question. So I guess the next question is also a pretty common question that's asked by breast cancer patients. So does my choice of surgery, the list of surgeries that you have mentioned and shared with us just now earlier on, affect the other cancer treatment that I'll need, which, for example, chemotherapy or radiation therapy?
It doesn't affect the timing. However, if you do breast conservation, so you save the breast, then you will have radiation. Okay, so it is a compulsory pairing of those two. So if you save the breast, you must have radiation. And so some of my patients actually choose sometimes to have a mastectomy, because if the cancer hasn't gone to the lymph nodes and then they've had a mastectomy, they can avoid radiation. And sometimes it is just a choice. But if you're talking about whether it affects when we can start chemotherapy and when we start radiation therapy, then the answer is no, because by and large, we are actually we do it very frequently. And so we do know how to manage it. And what we do know is that all the wounds will heal in time for the other treatments to start on time. And it's never a big issue at all. Yeah. So you can go ahead with reconstruction as part of the mastectomy, and you will still be enough time to start chemotherapy or radiation therapy if you did need them in the end.
I see. I guess from the patient's point of view, right? Wound healing probably is one of their concerns. That's why probably they will ask, am I okay?
Correct.
To on.
Yeah.
I haven't even feel that I have healed.
Yeah, I mean, I
Okay.
think, and especially for ladies who have diabetes or have a little bit of sensitive skin, all of them do ask this regularly, but even they heal in time and are able to proceed with treatment if they need it. Yeah.
Okay. So thank you, Dr. Chan. That's a very assuring answer. So I hope we have answered some of the pretty common questions that you have. So let's move on to next question. It's a question asked by Gloria. So how about patients that is having a targeted therapy? So is it okay to take the vaccine as well?
No, so for targeted therapy, it depends. There are now many types of treatment that come under targeted therapy. And if you want to be very niao about things, actually the endocrine therapy, so the anti-hormonal tablets are also a form of targeted therapy. But if you mean by targeted therapy something like Herceptin or the other immunotherapies, the immunotherapy agents tend to be given with chemotherapy. And so, yes, you shouldn't be getting the COVID vaccine at that time. Herceptin, if you're taking Herceptin only, because there are patients who need Herceptin, after chemotherapy is done, you will be on regular doses of Herceptin for at least the rest of the year. Herceptin does not affect your immune system. And so you should be safe to go ahead with the COVID vaccine. But certainly do check with your oncologist that they are happy for you to take it, because there may be other reasons why they think that it may be better to push the COVID vaccine back. So discuss it with them, because you will see them fairly often for your Herceptin anyways. And it should be easy to ask.
Thank you, Dr. Chan. So I hope we answered your question, Gloria. Okay, so if you have any questions for today, please feel free to add in the Facebook comment as well. If overwhelming questions, right, you may not be able to answer as well, but for now, I think we are still comfortable. So we have any questions asked by Miss Su To. So she will ask, where will the jab be if the arm has lymphoedema? I'm not too sure what do you mean by the jab. You mean?
I think the COVID vaccine.
Okay.
I assume that you're worried about, okay, so yeah, if you have lymphedema of the arm, do the vaccine on the other arm. It has to go into muscle. And so if both arms are affected, you can tell your GP or the doctor giving the vaccine or the nurse, they can put it at the back of your buttock as well. So it just needs to go into muscle. It is more convenient to go into the arm because then you don't have to remove clothes in a room. But if you really can't use either arm, then your buttock is fine.
I think that is a very important information for those who have bilateral lymph nodes removal, or you have lymphedema on both arms. Buttock is a long way. So yep. So let's move on to another question. Is asked by Miss Doris Low. So she say, "Hi, Dr. Chan. For breast cancer, this is also COVID vaccine. For breast cancer remission patient, can they take COVID vaccine?"
Yes.
Okay.
Yes, definitely take it.
Okay, so thanks for the questions, Doris. Let's see. Maybe another common question that you usually ask. How does my choice of breast conserving surgery rather than mastectomy affect my chances of surviving the breast cancer?
Not at all. So breast conserving surgery is as safe as doing a mastectomy, but the surgeons, when we do it, we are very strict about the margins that I was talking about. We do want to be sure that we've removed all the cancer from the breast, and you must have radiation for the remaining breast. If you do that, your survival is as good as having had a mastectomy. And actually, for certain groups of patients, the radiation actually provides better survival because it does protect you. And what we are finding is, especially in the slightly younger patients, the benefit from survival, it plays out in the end in the later years. So it actually makes a big difference.
I see. Okay. So probably one last question that we can cater for today. It's a question asked by one of the participants. Will the breast cancer survivor have lymphedema after many years?
Can. Yeah, I mean, lymphedema, unfortunately, is a potential consequence. It can happen anytime from 1 year after the operation until many, many years down the line. And what we know is that the most likely trigger is if you get an infection in the skin. So you have to be very careful in protecting it. The older we are, as you know, the skin becomes more and more dry. Then you need to moisturize it properly. And if for sometimes it's easy to forget. If you forget and then you actually get an injection in the arm, just make sure that the area, that site is cleaned very properly, and then you go back and it doesn't get infected. And by and large, if you are able to do that, it lowers the chances of getting lymphedema in your arm. But if it happens, let your doctors know, because we will send you for physiotherapy, and there actually are quite a few things that could be done to limit it so that it doesn't affect you as much.
I guess that's a follow-up question. So will there be lymphedema that will occur if there's no breast cancer? What else?
Yes,
Yeah.
but it usually can happen after a parasite infection, but fortunately these parasite infections are not in Singapore, they're in Africa.
Okay, that's good to know.
But yeah, it can come out because of infection as well, but by and large most of the world sees it because of an operation in the lymph nodes.
Okay. I actually saw two more questions. Maybe we can extend a little bit time for them as well. So Jessie is actually asking, what is a radial scar or radical scar? RADIAL scar. So she recently did a biopsy. I think she is quite concerned whether the scar will lead to a breast cancer.
Okay. So a radial scar is something that we only see in the laboratory under the microscope. There is a 10% chance there may be a cancer linked to it. So 90% of patients who get the radial scar after a biopsy, it comes back as just a radial scar only, which means it's just normal fibrotic tissue, it's benign. But your surgeon will always want to take it out because he doesn't want you to be the 1 in 10. If you're the 1 in 10, then you would need to go on to treatment that is needed for what we find at the time of after getting it out. But for the 9 out of 10 women who it is only a radial scar, you're normal. There's no additional breast cancer risk after that, but you should go on with regular screening, so mammograms every 2 years. I hope that makes it clear.
Okay, so we hope that we have answered your question. So due to time constraint, we are probably unable to finish answer all your questions. I'm so sorry about that. If you have any more questions, you can actually message us as well. We will try our best to help you link up if possible. Okay. Otherwise, I think you can always check back with your oncologists, surgeons, or doctors within your hospitals. If you have many questions about COVID vaccines for cancer patients as well. So I think hospital is also another checkpoint or resource that you can check back with them as well. Also, don't go around and Google. May not be the best information that you get. So yeah, so this is something I'd like to share with you guys as well. So I would like to thank Dr. Chan again today for sharing with us the breast cancer surgery, how the various type of treatment and surgery. So thank you, Dr. Chan, again.
No,
for
I
sharing with
hope
us.
it was useful.
Definitely is useful. So I would like to thank Jill again with sharing with us her cancer journey and also those very inspiring statements that she made. Indeed, we need to remind ourselves what keep us going during the battle against cancer, so that it keep us going. So not to worry about those who have correct answer, but you are not the prize winners. Okay, so I'd like to share with you there are also recipe books that will give out for the winners as well. So let just me share with you. Yeah, so there are a few recipe books that we have, like healthy diet, juice, and breakfast. So inside we have very comprehensive recipes that you can try on yourself. Previously during 2020, we also did a food demo for some of the recipes inside. So I think they are really very interesting and easy to make. You are able to do it yourself lah. So people like me, I don't cook, so I'm able to whip out one or two dish also on my own. So where you might ask me, Andrew, where can I get these healthy recipe books? They are all located at our 3 social service center. So just do drop in and collect from the center managers or the staff or my colleagues there. So they will pass you the recipe books. I think it's also a good chance for you to take a look at our centers as well, the activities and programs that are running. So I hope it's value adding to you guys today as well. So that's all for the recipe books and the winners. So for the winners today, please remember to message us your name and contact again. And I would like to move on to the next segment. I would like to announce some of the events that we are doing, collaborating as well in February and March. So what do we have in February to March? So we have this, we collaborated with National University Cancer Institute of Singapore. So they are the main organizer. So we have this ribbon challenge here. So in February, right, it is a World Cancer Day. So it's hopeful to create more awareness about how cancer is, how treatable, and you are not alone. So this is the QR code. So we hope all of you can go and scan the QR code. There will be many ribbons for you to choose. Each ribbon represents a particular cancer. So you can choose a ribbon of your choice and send a message to the loved ones or the cancer fighters or warriors out there and encourage them and make them feel that, cancer journey is not alone. They are not alone. We are all with them. So I hope you guys can scan the QR code and choose the ribbon and participate in this very meaningful event. So you may ask me, Andrew, I couldn't find this offline. Where can I find it? So don't worry. These posters will be in the National University Cancer Institute of Singapore in their social media, as well as at 365 Cancer Prevention Society social media as well. Okay. So up next, they all have also organized health talks in March. Yep. So they have an English session and a Mandarin one. So it is held. The English one is held on the 6th of March on a Saturday, 10 a.m. to 11:30, and the Mandarin one will be on the 6th of March. It is also on a Saturday, 2 to 3:30. So if you are interested in the list of the health talks, there's a QR code you can scan over there and register. So both of these health talks, you will need to register for the health talks. So moving on, I would like to announce what is the next health talk that we held in our platform, 365 Cancer Prevention Society. So the next health talk will be held in Mandarin. So I think the last health talk, right? Thanks, one of the participants has messaged us that she would like to have a gynae talk about gynae cancers. So here is it, we have for you. So it's about gynae cancers and what are the advanced treatment specific for gynae cancers. So the talk will be held in 20th of March, 8 p.m., same platform here. The talk will be conducted by Dr. Lim. She is the OncoCare Cancer Center Senior Consultant there. So she will share with us a lot more in detail what are the advanced treatment nowadays for gynae cancer. Okay, so that's all for the talk for the next month and the event. So thank you for attending this health talk with me today. I'd like to thank again Dr. Chan and Jill for sharing your informative information with us. So last but not the least, please remember and like the today's health talk again, so that more people can share and get more info from today's health talk again. So this is the link. Okay, so thank you everybody. So I will see you guys in March again.